Awesome. Hey, Tim, good to see you. Hi, everyone. My name's Sarah Marshall. I'm a speech language pathologist at the Waisman Center. I practice primarily in the communication aids and systems clinic in the area of augmentative and alternative communication. Molly, do you want to introduce yourself?
Sure. My name is Molly Neff. I am the parent representative of the ECHO Autism project for the medical arm of this. And so I'm going to represent the entire team, but in the aspects of the team, I am the parent.
Awesome. So I'm gonna, I think, share my screen here, see how this works. What do you see?
We have the ECHO projects along with the, there we go. Now we're seeing your presenter view.
Okay, let's see if I can swap that. How about now?
Now I am seeing it just the slideshow.
Great, excellent. And I'm gonna figure out how to quick share my sound as well. Awesome. So we're here today, Molly and I, to talk about the ECHO program, which is Extension of Community Healthcare Outcomes, and how we have both used ECHO to meet distance learning needs. It was planned to always be distant, but it worked out really well with COVID-19 to be able to continue these projects when everything moved online. So before we talk about our particular projects, I want to provide a little bit of overview about what ECHO is. And the idea really is to move knowledge, not patients or not people. So there's two different types of ECHO. The traditional ECHO model is that medical model, and that's what Molly's going to be talking about today when she talks about ECHO Autism. And that really is breaking down the walls between specialty and primary care, and really using like primary care or more local physicians to present patient cases to a specialty team to discuss new evidence, new developments, and to problem solve treatment. And those specialists really serve as mentors to colleagues in primary care. ECHO for Education is what I'll be talking about for our ECHO AAC programs, or Augmentative and Alternative Communication. And it follows the same model, but it's just a little bit different. It focuses a little bit more on discussion and coaching with an interdisciplinary group of educators and other professionals. Really a focus on capacity building and providing ongoing support for professionals working with students with disabilities in the pre-K to 12 setting. And again, it's focusing on presenting evidence-based practice. I could talk all day about ECHO and not explain it as well as these great vignettes. So I'm gonna try to play one of these.
To provide the best for our students, we need to be learning from the best. We all know the value of continuing education and collaboration, but time, geography, and weather conditions can make it difficult. UW ECHO in Education is changing that. It's a virtual learning community by educators, for educators. UW ECHO offers presentations every other week on specialty topics from regional and national experts, available via video conferencing technology to the education community. Following each presentation, you'll have the opportunity to collaborate with peers, experts, and professionals to discuss how you can apply these strategies in your schools and classrooms. You'll also be earning continuing education credits, and it's all free. Project ECHO, helping to change the world by sharing knowledge and doing it fast. Contact us today at projectecho@uwyo.edu to learn more.
So UW-Madison does not have a cool marketing video like that yet, but so the University of Wyoming is a training center for ECHO and education. And so we use their video here. That's where we went to become trained in the program. And then the other video, these slides will be made available, so I won't play this, but this is from the University of New Mexico, where they do a lot of the trainings for the traditional medical ECHO. So we'll talk a little bit more about the pieces of ECHO now that you had that little bit of that overview. There we go. So ECHO is really focused on this hub and spoke model, where you have a team of experts mentoring spokes of learners. It's a little unlike that traditional telehealth where you have like one doctor or one professional seeing one patient. This is really, you have a hub team that's often interdisciplinary that Molly and I will talk about later, mentoring a bunch of people. The really neat thing, and it's not depicted in this graph, but so the hub team, those experts, they're providing education to the spokes, but the spokes are also providing education to the hub team. I find this particularly relevant in our ECHO and education trainings. All of us at the Waisman Center are in a specialty center and we don't work in the school setting. And so I have learned so much from being in this hub and spoke model with school practitioners and educators, and that learning really goes both ways. And another piece that I don't think is depicted on this graph is that there should be lines between the spokes. You know, if a school teacher has a question about implementing AAC in the classroom, who better to learn that from than another school teacher who's had success in doing that, not necessarily from the specialist in the center here. Okay, lots of ways to kind of picture this ECHO model, but I love this ABCD little diagram here. The A stands for amplification or use of technology to leverage resources. So we use the Zoom platform, which I think over the past year, many of us have gotten familiar with. B stands for best practices, and that's very important. Like the video shared, we bring in both regional and national speakers who are experts in the different areas. Everybody on the hub team is a specialist in the area that we're providing education on and making sure that everything that we share is evidence-based. What makes ECHO unique is the case-based learning. There are tons of virtual learning where you just sit down at a Zoom call like this and you listen to people present, and that's awesome. But where ECHO differs and what makes ECHO special is this case-based learning. So the first half of your ECHO session, you're sitting there and you're learning from an expert on a topic. But the second half gives you an opportunity to apply that knowledge to a case. So that's where one of the spokes, an audience member, presents a case, and all of the other spokes and participants have an opportunity to offer ideas, and the hub team's there to facilitate that. We then run through all of those recommendations, and after the ECHO session's over, check them with the evidence base and send out evidence-based recommendations from that case-based learning to the group so that everybody has access to those shared resources. And then D stands for database. We love monitoring outcomes, and you'll get to see some of those today from the past year. So it works by using technology and collaborative learning, really allowing specialty care to get out into local communities without anybody paying money, driving, anything like that. So really the goal is to just get it out there far, wide, and free. So like I said, we work at the Waisman Center in the University Center for Excellence in Developmental Disabilities, or UCED. And the UCED supported ECHO as a method for us to do this capacity building as a center. Our current programs are ECHO AAC, which I'm going to talk about next, and then ECHO Autism Wisconsin, which Molly will talk about a little later. Okay. So now that you have a little bit of an idea about what ECHO is, I'll talk about ECHO AAC. And this, again, is the ECHO and education model. It mirrors a community of practice quite a bit, but it isn't a community of practice, although there's currently a research study kind of investigating, do people who participate in ECHO naturally form a community of practice through this model? So our hub team for ECHO AAC, we have our Waisman Center AAC program staff. So I co-lead with Catherine Cantor, who's another speech language pathologist, but the rest of the speech language pathologists on our team also are participants on our hub team, as well as our occupational therapist to bring in that interdisciplinary component. Our hub team also includes community experts or prior spokes, especially because we're doing ECHO in education and focusing so heavily on using AAC in the school setting. None of us have worked in the school setting, and so we invite school providers to actually present as our experts in our ECHO sessions. We have other university experts. We have a great partnership with Penn State, who is a leader in the field of, or in the area of AAC. University of Florida, we have just really great partnerships of researchers who have, and clinicians who have dedicated their time and donated their time to this project. And then we coordinate and collaborate with other USEDs as well, who share that same mission for capacity building and outreach. Our spokes. It's an interdisciplinary cohort. Right now we have 11 unique disciplines that I'll share in a second, and over 500 individuals registered who receive our emails. Not that many participate in ECHO. A typical ECHO attendance is around 50 to 100 people, but over 500 do receive our emails and are interested in learning. I apologize that this is a little bit blurry, but here's just a breakdown of the different participants we have. So you'll see the largest group here are speech language pathologists, and that's because we're talking about AAC. However, what we know about augmentative and alternative communication is it only works if the entire team is involved. And that's why we're really excited to see individuals who use AAC themselves, parents, psychologists, social workers, teachers, paraprofessionals, others, all involved in our ECHO session for that really neat interdisciplinary component. So our initial launch was ECHO AAC, and that's our core program, and I'll talk through what that is before I go through the offshoots. So ECHO AAC is offered in the fall and the spring. It's a 6-session series, and each session is an hour and a half. That 45 minutes of didactic, 45 minutes of case-based problem solving, and this one is open for interdisciplinary involvement. You don't have to commit to attend them all, you just pop in if it's a topic that interests you. We launched this actually, I believe the week or the week after the COVID-19 initial shutdown. And so we just finished our 3rd series. So we've done 18 sessions so far. And our reach has been pretty significant. 197 individuals have participated, and that's from 94 unique school districts across 38 counties. And what's not depicted here are 15 states now have representatives in our ECHO community. Those 3 chunks of 6 sessions have provided over 20 hours of free continuing education. And over 90% of these 197 participants are in the school setting, which is really exciting to see that even people all the way up in Douglas County are able to access this information and support their learners who use AAC. So the topics that we've offered so far, spring 2020 when we launched, we talked about partner roles in augmentative and alternative communication, things like core vocabulary, peer-mediated intervention, language intervention. In the fall, we provided some information about teletherapy and AAC and what that looks like, culturally and linguistic considerations and literacy, which is a huge hot topic. And then this most recent session, we talked about what do we do when we have a lot of learners with different systems in a classroom? How can we implement those? How do we support parents? The topic of functional communication training and Project Core. And most of these topics were selected based on a needs assessment that we completed, asking people what they wanted, as well as our own review of the literature on what leads to successful outcomes. In terms of our feedback, we've had great feedback. You can't get your continuing education unless you do the survey, so people are kind of stuck participating in our survey here, but 100% said that they would attend another ECHO. Over 98% agreed or strongly agreed that the topics were useful, both the professional development and the case study. They plan to share the information with others and would make a change in their practice, which is really, really exciting. I do not have time to go through these quotes, but we'll make the slides available, and even the bold words are just really cool to see. People are just supporters of ECHO, helps them feel inspired and motivated, part of a community, and provided encouragement. I think especially in small districts, any educator, speech language pathologist, teacher, paraprofessional, it's easy to feel alone if you only have one student on your caseload who has complex communication needs. And so this just offers a really great way to connect with others going through similar things. Enhancement professional teaching and practices, and they hope it continues. Okay, so our little offshoots. So that's ECHO traditional, but we also offered ECHO AAC Autism, and this was offered last summer, and it focused exclusively on children with autism who use AAC, and an interdisciplinary collaboration with board certified behavior analysts, line therapists, social workers, counselors, and speech language pathologists. And we had representation from 6 different autism treatment programs in Wisconsin. We do hope to offer this again. It was really neat to, I jumped on late, but I heard a little bit of discussion about naturalistic versus like discrete trial type training. And it was really cool to just have discussions with the psychologists that work with the children I work with as a speech language pathologist about how both approaches may be appropriate for different goals for students. So it was a really neat collaboration. And right now we are in the middle of launching ECHO AAC Families. And this has been the best ECHO so far, if I had to choose. And it's focusing on family and consumer involvement. So we have a family member on our HubTeam, and we have an augmentative and alternative communicator also on our HubTeam. And the topics have really been focused on supporting parents in implementing AAC in the home, how to implement it in the community, how to get started. And it's just been really neat to have a safe place for parents to meet other parents and foster that connection. So our next steps for ECHO AAC is we will continue with our ECHO AAC fall and spring semesters. This is an open cohort where you can just pop in as you are interested in the topic. We're going to continue with ECHO AAC Families 1 time a month, also with that open cohort where you can just pop in. And then we're going to be piloting some specialty topics with a closed cohort. So for example, this fall, we're going to be doing a 4-session series on AAC evaluation, or the feature matching process. And we're going to be limiting the cohort to a certain number of people and asking that everybody who enrolls commits to attend at least 75% of the sessions so that they get all of the information to be skilled in that area. And with that, I'm going to turn it over to Molly to talk about ECHO Autism Wisconsin.
Thank you. And Sarah covered so much of what I would have said about all these topic areas. So I'm going to focus on just the sessions and the different topic areas that we covered. This is not a surprising chart to anybody that's here, but this is really the reason behind why we did what we did with the ECHO Autism Project from the medical model. We want to increase autism awareness and acceptance. We want to increase appropriate referrals. It says increase referrals, but there are increased referrals. We just want to make sure they're done right. We want to make sure that parents that are seeking answers and children that need help are getting the help that they need from the resources that they have. There's very few treatment options, few trained professionals, and very long wait lists at these specialty centers. So if we can increase the education that goes out to the primary care and family medicine providers, the hope here is that we can really reduce that gap in obtaining the appropriate healthcare that they need and increase their chance to getting to the treatment that they need. Next slide. So really, this is looking at primary care providers, or PCP, efficacy in identification of autism symptoms for children between 12 months and 18 years old. We actually, 12 months and 18 years old. Yes, I said it right. For a second there, I thought I said 12 months and 18 months. And also to increase PCP self-efficacy in assessing and treating common medical and psychiatric comorbid conditions in children with autism. Next slide. So the topic areas that we do is both in screening and diagnosis, resources and supports for children and families. We do a completely full didactic on just supporting parents and families. The common medical concerns, we do feeding, constipation, sleep. We do specifically home safety that involves pica, elopement, wandering, and repetitive behaviors. We do common behavioral and psychiatric concerns, anxiety, ADHD, aggression, safety again. You can tell I'm the safety gal. Next slide. These are the specific sessions. So starting off with what is autism, which covers the DSM-5 criteria, screening and next steps. We go over routine screening tools, how to get appropriate referrals, find those referrals in the community, medical follow-up, genetics evaluations. We do discussions on what labs or other diagnostics you may want to obtain and when to obtain those appropriately. Supporting families, we go through not only how to approach families, we go through where they're at in the grief cycle and how to make sure that you involve them at all levels of the care, how you have those informed decision-making. Autism resources, we're looking at within the community, how you find providers, how you find outside treatment, how you get them in touch with the regional centers, with Katie Beckett programs, treatment options. We go through ABA therapies. We have a therapist that comes in. We talk about speech and occupational therapies, any evidence-based therapies that we have. Feeding and constipation, that's always a hot topic. Everybody loves that one. We talk about picky eating. We talk about overeating. We talk about constipation, when to go for medical management versus dietary. ADHD, hyperactivity disorder, and autism, we talk about prevalence frequency. We also talk about treatment options, when to start. Sleep and autism is the other hot button topic area. And we talk about environmental controls, when to start medications, when not to start medications, and how to involve parents in those discussions as well. Same with anxiety, just like attention deficit disorder. When it becomes a problem, how to help parents identify it's a problem, irritability, the same. And then safety, we go through general home safety, community safety, how to help parents plan for that, and when you should help them identify additional resources for that. Next slide. This is our hub team. So we have Danielle Schulze, who's a developmental pediatrician. We have a psychologist, Martha Walter, on. We have Amy Lyle, who's a social worker, and then we have myself. And I wanted to point out, Maria mentioned, and it's a great comment, we really need to involve parents in all these sessions. And I hope we've answered your question that parents are definitely involved in the Autism AAC work as well. In our session, we do have the parent as a hub team or expert member. I don't know that I consider myself an expert, but that's what they call me. But I also find it very important that I branch out to other parents, because having just my opinion is really not super helpful. So I have a team of other parents that I talk to and generally consult with, so that I make sure that multiple voices are heard in this. And next slide. Oh, that's it.
That's it. That's the slide.
I'd have kept talking forever.
Oh, and look, I was not even watching the chat. Let's see here.
It's okay. I've been keeping an eye on it for you guys. And
yes.
I've thrown in a couple of, websites, which I know will also be shared when you share your slides. But the questions that we have is the open session for July. Can people attend virtually, which I think you should clarify for virtually, and then who might want to be involved? Do they need to be invited? Because you guys just laid out a super exciting thing.
Lots of stuff. For us and for the AAC, these are only virtual options. We don't have an in-person location for you to come to. So yes, you may attend virtually. For the medical model, it is geared towards providers. So generally family practice physician, any type of primary care provider, and PPA. And we do send out marketing communication to lots of different organizations to try to get some involvement there.
Molly, I see another one for you.
That does look like for me.
Yeah.
So the model for physicians is to learn more about what screening might get them to a referral and when is the appropriate time for referrals. At this point in time, we have not gone into the special training that would require for primary care to do their own diagnosis at their site. I'm not familiar with any primary care providers that do specifically that advanced diagnostics at their site.
And I don't think that question was for me about open sessions and attending, but if anyone is interested, for ECHO AAC, it is open to parents, professionals, whoever wants to learn more about AAC. And you just email I'll put in the chat. You just email us if you're interested in being on our mailing list, and then you can get full access to notification of when live sessions are, and then view all of the recordings. We only record the didactic, so you won't be able to see the case study. But you have access to all of those.
And I have to add, Anne's adding such good information in the chat. Thank you so much. Yes, pica is the eating of non-food items. Anytime a child eats something that's not nutritive or is not meant for consumption. And then she did clarify my statement. It is not about teaching primary care providers about diagnosis specifically, but how to increase the capacity for treatment and support. How do we get them the appropriate referrals to the appropriate locations to really reduce those inappropriate referrals to specialty care providers. And I owe you a thank you card.
Other questions we could answer? That was a lot of information.
I guess I have a question. Now that you guys have experienced AAC or ECHO, do you see other areas where this could be useful, especially for getting parents involved? So just, I know it's all speculation. We are being recorded, but that's okay. But just what would you, I mean, where else, this is just really exciting to me. Where else do you think this might be useful?
Well, Tim, I think you did kind of an ECHO model, didn't you? When you had parent panels come on and talk about safety from multiple different perspectives, and we learned from each other. I mean, that's essentially the model that, so you saw it kind of in action, even though you haven't participated in these, but that's exactly what it is. You get a hub team of people that have that knowledge and information, share it with the spokes. The spokes have great knowledge and they bring it right back. So I think the model works for a lot of different things, but yes, if you guys have ideas of things that would be appropriate for expanding, we're always trying to think of and troubleshoot. And obviously the AAC, man, you guys will take any topic and roll with it. I love it. You just expanding, identifying all these needs. And I think it's great.
That's the great thing about ECHO is it's just so flexible. If you're implementing the ECHO program correctly, it really can be to teach just about any topic there's a need for. It's really just those ABCD principles that we talked about earlier, and making sure that it's virtual, that's part of ECHO, that you have didactic evidence-based content delivered by experts, and that you offer a platform for collaborative case-based learning. And I think that like I said earlier, that case-based learning is what really allows you to apply the knowledge. I think virtually it's really easy for me to become just a more passive listener, and I'm taking in the information, but then I have to go do that extra step of like, back at work tomorrow, then I'm going to try to apply it, but I'm by myself and I'm not sure. And ECHO is just really cool because you get a safe place to practice it with other people immediately before you log off the call.
Please feel free to unmute if you have other questions, or I guess we are at that point. So the formal presentation is done. Thank you. Somebody just sort of reminded me that this is usually when I turn off the recording so that people can freely unmask if they would like, or just ask their questions. So just give me one moment. Thank you guys both very much, though formally on the recording. Thank you both very much. I'm going to turn off the recording and we'll continue with some questions.